The good. The bad. The ugly. In the name of awareness and advocacy.
Hello, everybody. Welcome to On The Air Sickled. My name is OD. I am the host and executive director of this awesome podcast, and you're listening to a global podcast where we air the good, the bad, the ugly in the name of awareness and advocacy. Our guest today is none other than Dr. Lewis Thomas, and that episode is coming at you live right now.
On the air sickled, you are never alone. Together we're stronger. Together we've grown. On the air sickled, where love shines through. Awareness, compassion for me and you. On the air sickled.
Hello again. Thank you all so much for joining us for our podcast. Listen, I'm so excited for this conversation with Dr. Lewis Thomas. He is coming live from the UK. Like I said earlier, we are a global virtual podcast. So excited for the opportunity to be able to do this. We have interviewed several people from Africa, from Canada, and now we're entering the UK. Actually, this might be our second conversation in the UK. And so we're so excited to be able to have these this open dialogue to be able to discuss sickle cell disease and its implications on our community. Listen, before we get started, I want to talk a little bit about the video package that we showed earlier about mental health. I want you to know that if you are going through mental health challenges, that On The Air Sickled is here to support you. We have a chaplain that is available to be able to pray with you and to be able to support you spiritually, to be able to give you comfort and to be able to have conversations while you're going through. He is also a certified healthcare sickle cell navigator. And so he'll be able to understand those things that you go through, not just from an outside perspective, but as someone from the outside who has seen the implications of sickle cell disease and its impact on you. Whether you're dealing with stress, the loss of a loved one, On The Air Sickled is here to fight the good fight with you. So if you need help and you need support dealing with mental health, please remember, just like our intro says, you are never alone and we are here to help. All right. As you can see, I'm wearing my heated jacket because it is cold, ladies and gentlemen. It is freezing. And so let's talk about today's weather. Today's weather is going to be a high of 54 degrees, low of 32. It feels more like it's on the low side right now. Tomorrow is going to be a high of 51 and a low of 38 degrees. Make sure that you guys stay bundled up. Get your heated jackets if you need to. Stay warm, take your medication, stay hydrated, and stay out of the hospital. We do not want to give the people our money. All right. Now, without further ado, it is time to bring in our guest, Dr. Lewis Thomas. You are live on the air.
Hello. Thank you for
Hi,
the
my
epic
friend.
introduction.
How are you?
Yeah, I've got a bit of the sniffles, so sorry if I sound a bit grizzly, but I'm happy to be here. Thank you for allowing me to be a part of it.
Oh, absolutely. Listen, so you're in the UK. What is the weather like right now over there?
It's pretty depressing. Cold, dark, miserable, wet. So yeah, the heated jacket is a must. I wish I've only just recently found out about them actually.
Oh, wow.
Cool. I might get one myself.
Yeah, I just learned that they actually have heated gloves now. They have they do have, so this one covers my chest and my back, but they do have a heated one where it'll cover your arm as well. So they're adapting, they're adjusting. I don't know if it's necessary for sickle cell, but I think the sickle cell community can definitely benefit. So listen, I'm excited to join to get into this conversation with you. You are the founder of Sickleverse. Can you tell us a little bit about that?
Yeah, sure. So the Sickleverse is an online community for people living with sickle cell. So if you're a sickle cell warrior, carer, or advocate, it's basically a space that you can connect to other people going through the same issues. But the sort of main feature of it is as an educational platform. So it's a way for me to bring all of the kind of educational content that I've been doing on social media for the last 6 months in an organized way that people can access without having to sort of go through the algorithm of social media. So there's a few different features that I'm currently restructuring at the moment because it's literally just launched like 2-3 weeks ago. So I'm just kind of like evaluating things and trying to figure out what's working and what's not. So yeah, there's going to be some changes coming up, but yeah, it's got 180 or so people joined now, and yeah, everyone's really looking forward to learning and being able to sort of get the insights that I have available to offer, you know, from that sort of medical experience and lived experience perspective.
Wow. This is great. So you're actually the second doctor to be able to join our podcast. Our other partner is the founder of Sickle Cell Medical Advocacy. And before I continue, I just want to go ahead and talk about our sponsor. All right, ladies and gentlemen, this is an opportunity where we want to give attention to Sickle Cell Medical Advocacy. Sickle Cell Medical Advocacy is an organization created to support you to navigate the medical system. So that means that if you're having a hard time getting your medications, you're having a hard time communicating with the doctors and the nurses, and maybe you just need some additional support and guidance and to be able to get the comfort and the medical advice that you need, contact Sickle Cell Medical Advocacy today. You can connect with them at www.sicklecellmedicaladvocacy.org. Dr. Simone Yuan is the founder. She is also a sickle cell warrior, and she is one that is willing to stand in the gap for you to be able to build that bridge between you and the doctors. So thank you, Sickle Cell Medical Advocacy. All right. So like I said, you're the second doctor to be part of our show. And so talk to me a little bit about your education. What made you decide to become a doctor? What's your focus? And are you still practicing?
Yeah, sure. Just wanted to stay on the sickle cell medical advocacy. I met Dr. Simone Yuan last week in Orlando.
Wow.
And we chatted for like 3 hours, and she's amazing. And what she's doing with sickle cell medical advocacy is amazing and just like very inspiring. So I just wanted to give her a shout out, and yeah, great.
Oh, wow. Look at that.
Yeah.
I had no idea. There you go.
Small world. So back to me, I guess, having sickle cell, I ended up in hospital for the first time when I was 12 with my first sickle cell crisis.
Wow.
And that was like the first time that I was really aware of having sickle cell. I was quite fortunate in that I had a pretty good childhood. Was able to sort of, you know, do most things without really being aware that I was restricted. And I have sickle cell hemoglobin C disease, SC genotype. So generally milder than SS. And I think for me, I had like a higher level of fetal hemoglobin. They think it wasn't actually like proven, but I had a really bad crisis, was in the hospital, and it really got me sort of aware of the fact that I needed to figure out how to sort of live with this condition. And look after myself, particularly because the general medical staff didn't seem to be that aware of sickle cell. That was like something I was like, oh my God, like I have this thing that's causing incredible pain, and I might go into hospital and people actually don't know what's going on. I have to like explain it. They might not know how to treat it. So in my sort of like mind, I think subconsciously I was like, I need to learn as much as I can about this so that I can take care of myself. And also there's going to be other people living with this, going through the same thing. So who better than me to be able to help them as well? Because, I want to help people. So yeah, that was what got me obviously to want to become a doctor, because I was into science as well. And I ended up going to med school, and I had a good experience in med school. I think it was obviously like that transition phase between childhood and adulthood, and the freedom of not having to sort of feel restricted by my parents' rules, and just being able to go crazy and try lots of different things out. I think I've always kind of like been like that, wanted to push the limits and try things, because from the age of 12, I did have like crises maybe every year or two, and like maybe like a hospital admission every couple of years. So that was pretty much because I would just overexert myself playing sport, because I was really active and sporty, and it would normally be a case of overexertion or with dehydration that caught me out. So during university, there were lots of those kind of things as well, but I managed to sort of have like a fairly normal experience. Afterwards, I started as a junior doctor, and it was the most stressful period of my life probably. And I started having more sickle cell crisis more frequently. Like I remember literally having to walk down the hospital corridor where I was like living in hospital accommodation. And it was the first week of, it wasn't the first week, it was maybe like the first few weeks that I'd started as a doctor living in this hospital, before I got my like flat and rent sorted and everything. And I ended up having a sickle cell crisis and being like, oh my God, like I've literally got to have to go to the accident and emergency department in the same hospital where I'm working and where I've just met all like these new colleagues, and you have to go through that sort of thing of telling people that you have sickle cell, and they're like, oh my God, what? Would have never have guessed. So yeah, that was kind of like the start of the difficulties. Following that, I think I just started to really not enjoy it. What the job itself wasn't really what I thought it would be. It was just very stressful, like working on calls, night shifts. And I think it affected me perhaps more so than others because of the whole sort of recovery time. So I think I would be able to do it because also there's this sense that you're at work and you're looking after people. So you just turn it on and you just push through. But then as soon as I got home, I was just done. I was having to sort of stay in and recover and didn't want to like do anything or socialize. So I wasn't really having as much energy and time to do activities that I enjoyed outside of work. So it became kind of like work was all consuming. It was all I was doing. And that went on for like a few years. Eventually did go on. So I started on hydroxyurea. I wasn't on any medication around the time I just started. And then 2 years after I started working as a junior doctor, I started hydroxyurea because I was having more sickle cell crisis. So essentially, the hydroxyurea stops me from having hospital admissions. I didn't have any hospital admissions for 10 years. I had the odd crisis that I could sort of manage at home, but I was able to live my life a little bit more. However, I was still sort of feeling like it's just a constant thing where worrying about the threat of having a crisis, particularly in terms of like, people want to go out or do activities, and I've just sort of finished like a run of shifts or nights, and everyone else is good to go straight away, whereas I would be like having to think about, this is probably going to be too much for me to do without risking a crisis because I haven't recovered yet. So that was what kind of led me to really thinking about whether medicine and being a doctor was a sustainable career for me personally. And over the years, I became disillusioned with the whole medical system, just from the point of view of not being able to do what I'd been trained to do, and not being able to actually care for people in the way that I wanted to, because I feel like that was the reason that I became a doctor. When I was like having my own sickle cell crisis and I was 12, and I was like, I want to help people. Like, I always had that. And it takes you a while to see the patterns in the system of people going around in circles and recognize, this isn't really working like it should do. And the people at the top don't really care that much. They don't really have that same empathy.
Whoa, Doc. Okay. All right. Oh, I love this podcast, man. Okay. All right. So you're saying you got into this field so that you can care for people the way that they should be cared for, but you were unable to do that because of the system.
Yeah.
Talk about that. What do you mean by that? You're a doctor. You like, okay, I'm your patient and you see my symptoms. What works for me, and this is public knowledge, what works for me is Dilaudid, IV, and Benadryl. Okay. I need around the clock treatment, whatever the case may be. I need support. But you, as a warrior, also as a physician, are kind of in between, two realities. Psychologically, what does that do for you?
I guess I jump from one to the other, when I have like my doctor hat on, when I'm at work, I am, in the identity of a doctor, and I'm doing my best. And I would say as well that I was specialized in family medicine, so as a general practitioner. And that meant that I didn't see very many sickle cell patients.
Okay.
However, I did see people who I could identify with who was suffering from painful conditions. And I think having that empathy, in terms of always thinking about, I know what pain feels like, and I never want anyone to feel the same way that I did. And I also know about the issues of invisible pain and being made to feel like a fraud, and people not listening to you. So that is something that I've always just naturally been good at, listening to people and understanding where they're coming from. And I think that has affected the way that I've practiced medicine, and the way that I've cared for people, because I've always been able to put myself in their shoes, because I've seen it, what it's like being a patient and feeling like you're not being listened to, and feeling like you're dependent on these people for your your well-being, and the difference between being in pain or not is completely within their control. So, when it comes down to a lot of scenarios where people are presenting in pain or painful conditions, I'm just going to give them what they need to get out of pain. And it's just a very simple, straightforward thing. I've been trained, and conditioned the same way that everyone else has, in terms of avoid opioids and, drug seeking behaviors. You've got to like spot that and not get caught out by patients that are trying to take advantage of you or take advantage of the system. And I think those kind of messages are like just blasted at doctors and healthcare professionals. And I think if you don't have, your own sort of experience of being a patient and needing strong painkillers, it's very easy to be influenced by all of that conditioning against opioids, and the fear of getting caught out by someone who's drug seeking, malingering, and yeah, let's be honest, like it is a bit of systemic racism as well, because if there is a Black patient that genuinely is a drug addict, right, and comes in and tries to sneak doses or whatever, and they're seen, that is then associated with everyone that comes after them, so that's then associated with genuine people that come in and need strong painkillers because of the racial connection, and I think that's something that I was always very aware of. But then, like, sorry, I'm going to ramble here now, but even in other circumstances as a doctor, I remember in my first year, I was covering on call on a general surgery ward, and I was on night shift, and I was the only doctor for this ward, and there was a white guy that had pancreatitis, like a really painful condition, this infected pseudocyst, basically had like really severe back pain. And I'm seeing this guy sort of like bent over in pain, and reading his chart. There was basically just like multiple notes saying that he was an intravenous drug user, heroin addict, and it's just like his medication chart was there was no sort of opioids, or there was like limited dose of it. And he'd already had everything that he was written up for, and the nurses came and said, this guy is in pain. Can you write him up for something else? And I could see how much pain he was in, so I just wrote up an extra dose to keep him comfortable. The following day, the morning staff come on the ward round, and the other junior doctor who's taking over from me is basically giving like this attitude of, oh, who prescribed him morphine overnight? He's an intravenous drug addict. Why are you giving him morphine? And it really made me realize that a lot of doctors, a lot of healthcare staff have this stigma for drug abuse. And what that stigma does is it overrides the fact that you have people that are in pain and people that are suffering. And it's somehow like people are allowed to suffer if you think that they're a drug user. It's okay, because as long as I deem them a drug user, it means I don't have to, worry about the fact that they're in pain. It means they're, and I think that's what happens a lot to people with sickle cell because of institutional racism, and because of lots of issues surrounding invisible pain and the way that healthcare professionals perceive pain. So that's just my 2 cents. I think having sickle cell myself has just made me more acutely aware of when people are in pain and more willing to relieve the pain that they're in the acute situation and worry about whether they're a drug addict later. I'm not gonna rehab someone in the emergency department. Like there's bigger fish to fry than that. If someone has a diagnosis of a painful condition and they're saying that they're in pain, then it's better just to take them at their word and just listen to them and trust them, because you're not gonna you can't tell, and there's no point playing that game because you're gonna catch a lot of unfortunate people in the crossfire.
Yeah. Wow. This is good stuff. This is good stuff. I love this because I've had a nurse on the show before who has she was a traveling nurse, and she expressed that she would hear conversations about sickle cell patients, and she too had sickle cell, but because she was a traveling nurse, no one knew. So it was just all these conversations about how the patient is a drug seeker and how they can't be in real pain, and so to hear it from you from a doctor's perspective is like, man, I mean, I'm prescribing medication because the patient is in apparent pain, and has a diagnosis, and he's here or she is here because they're suffering, and we are here to relieve them. And even still, there's this force against the sickle cell community or against chronic illnesses that are just like, oh well, it's okay, they'll be fine, and at that point it's like, and I also understand respectfully that there's a certain limitation that you all as physicians have to, because your license is on the line, whether or not you prescribe certain medications or overly prescribe it, you have to be careful about that. So I also understand that. But when you do notice that there is someone who is here for support and they are in apparent pain, that's what they're here for. And Dr. Simone, since we talked about Dr. Simone, she would often share with us as navigators. I'm also a navigator. If someone wanted to get drugs, then they would go on the street and go get them. Why would they intentionally sign up to get a medical bill from an emergency room to try, to get drugs?
It's crazy, isn't it?
Yeah. So let's get back to the Sickleverse. So every time I think it's such a cool title because I think of Spideyverse. So when you're creating this program, this platform of information, you are also talking about this on your social media as well. Yeah.
Yeah. So basically, like, the social media is something that I've primarily been focusing on. And the Sickleverse came as a result of all of the kind of engagement I was getting on social media. So people were wanting help, people were asking questions, and then I just had the idea, instead of interacting with people in the DMs and not being able to sort of, have like a full, complete conversation, I should just create a platform where I can engage with people who want help and, who see my videos and may have their own questions related to their personal condition, or, may want seeking a bit of further understanding or just want my opinion on something. So I initially created a one-to-one advice and guidance service on WhatsApp. So I just put aside some time, 3 days a week, where people could book in and talk to me on WhatsApp, and tell me what their problem is. And then we just have like 15 minutes and I help them out and just resolve the issue, because I've been a GP and I'm a generalist. So pretty much anything anyone can walk in and talk about anything. So I'm very used to sort of being able to resolve broad general problems. And then obviously with my sickle cell experience, it just worked very well. So yeah, then I just put that together with the videos that I've been releasing on social media, and thought it would be good to have sort of like a categorized library of content for people if they wanted to, you know, do more intentional studying, but also just still get that sort of bite-sized micro learning, because they're just like very short videos that you can just watch at your leisure and learn. So all of these videos that are on my TikTok are in the Sickleverse. So if you want to sort of watch a video about leg ulcers, then you can go on the chronic complications tab and you can see leg ulcers. If you want to watch a video on, you know, understanding different genotypes in sickle cells, and that's categorized, you can watch different videos. And then I also have like mental health and some of the lifestyle and work related stuff that I was doing initially. So there's all sorts on there to just kind of check out. And I'm building new features based on what people are sort of, you know, looking for and needing help with. But also obviously thinking of ways to sustain it for me, because this is the main concern right now. I need to be able to sustain this work that I'm doing. So that's kind of what I'm going to be thinking about over the sort of Christmas and New Year period to start fresh in January.
Yeah. No, I mean, and it's funny that because that's what I was thinking is how much is this going to cost you to be able to put all this together? You know, it's something that I say all the time on the show is, you know, hey, I'm not coming onto the show to plead and ask and beg for your money, but money does support the mission, and it's something that I've said often, and there is a purpose behind this, right? And so, you know, being able to support and invest in projects like Sickleverse or On The Air Sickled, it helps us to get our stories out there, you know, and to really cast a light on the discrepancies that happen in the medical system. I love the fact that you are, you know, that you're doing this as a platform. I saw that you had discussion groups on there, one-on-one support. I mean, it really is beneficial because not everybody responds in a group setting, right? And they will probably just rather have an individual conversation. You know, so it's just really cool to see that you're doing things like this. Have you gotten any feedback on it at all? I know you just launched it.
Yeah, I mean, I have a lot of feedback from the one-to-one. People really liked the fact that I was a doctor as well, and they sort of had that trust, and could rely on what I was saying, especially when it comes to things that, you know, like hydroxyurea and deciding on medications and things like that. I could say, like, you know, I've experienced this as well, having sickle cell. So the feedback from the one-to-one was that. And then obviously with the recent launch of the Sickleverse and the community aspect and forums, I think that's still early days, but people are quite excited, you know, for the engagement that's to come. It's just I think getting it going is always going to take a while because everyone's a little bit shy to post and be seen, but it will get there.
Yeah, I'm looking away from the camera because I'm actually looking at your website. And so tell me a little bit about this the omega-3, the cheat sheet.
Oh, right. Okay. So that was like a sort of resource handout that I created a while back when I had I'd started this sort of omega-3 trial. So I measured first of all, I found out that omega-3 was something that can improve sickle cell. And it basically reduces inflammation in the blood and reduces the chances of you having sickle cell crisis. So there were some studies that showed evidence that it helped improve outcomes in sickle cell patients, like children and adults. But this was at a higher than usual dose. So it wasn't like the standard dose that you could get from most supplements. You had to buy like special strong ones. The omega-3 cheat sheet was basically, I put together a list of omega-3 food sources for people, because there's a lot of sort of dietary considerations, a lot of changes you can make to try and increase your omega-3 levels. And omega-3 isn't just omega-3, there are different types of it as well. Okay. So they're basically different a group of fatty acids, and some of them, EPA and DHA, are basically better for sickle cell. So it's those ones specifically that you need to increase more of in your diet. So the cheat sheet basically just sort of tells you which omega-3 sources have the DHA and EPA, the special forms in that are actually going to help, and which foods don't. So it's a good resource. I might add a little bit to it once I've checked my own omega-3 level, because that was kind of the plan. I did it initially. I showed everyone it was like terrible, and I was like, "Oh my god, the diet's so bad." So I thought I'll go on a supplement and I'll make these dietary changes, and then I'll retest it. So I haven't got around to retesting it yet. So, but I haven't had a sickle cell crisis since I started doing that. So. Yeah.
Oh, so something is working. Yeah. That's really cool. Okay. All right. And we're running out of time. I wanted to, so your also an author is, from what I can see, you have an ebook. Yes. Talk to us a little bit about your book.
So the book, again, just came from a lot of questions that I was getting asked about treatments. So I decided to just put all of the sort of current evidence and knowledge about treatments that are used in sickle cell into a book, and also include explanations of the treatments, like the side effects and how they work, and the modern therapies are included in that as well. So bone marrow transplant and gene therapy. I just wanted to provide like a basic, easy to understand explanation of how they work so that anyone can understand it. And then I've just given my own sort of, I've given my own perspective on some of the more controversial issues regarding particularly hydroxyurea when it comes to like cancer and fertility. It's just a collection of information that is going to answer the majority of the questions that people tend to ask me about when it comes to treatments. So I don't want to. It's like I can completely take you through the detail of it, but
this is great. No, I mean, like I said, I like like the fact that you're doing so much for the sickle cell community, and our goal is to get this information out there. That's why we air the good, the bad, the ugly in the name of awareness, right, and advocacy. So this is great resource, I think, for our audience members to tap in and hopefully provide some support for you. And so where can it's an ebook, where can they find your book?
So you can find the book at sicklecellbook.com. So just all one word, sicklecellbook.com. That's the easiest way to get to the web page for the book.
Okay. All right. Awesome. Well, I mean, I think that is all that I have. But listen, this is the part of the show where I isolate our guests and give you all the screen so that you can be able to look directly into the camera and talk to our audience and share whatever information is on your heart, whether it's motivational, educational, whatever the case may be. 30 seconds, the platform is yours.
Oh, wow. Okay. So, yeah, I think I want to let you know that if you have sickle cell and, you're struggling, you can still achieve what you want to achieve. You can still be happy and successful. You just have to spend some time thinking about how you're going to do it in your own way. And I think you need to also try and detach yourself from what society deems as successful based on people who don't have sickle cell, and stop trying to fit in with the norm. That's what I always say. Like, no one who achieves anything extraordinary is worried about trying to fit in with the norm. So that's my message, particularly if you're sort of like going from the transition from childhood to adult and you're trying to find yourself. Please, please, please just be yourself and trust that you're enough, and you'll get to where you want to go.
All right, ladies and gentlemen, thank you so much for tuning in. That is Dr. Lewis Thomas. He is the founder of Sickleverse. Please go to his website and follow him on all of his social media handles. Get his book so that you have all the resources at your fingertips, and that you're educated on all things sickle cell. Dr. Thomas, thank you so much for joining us. If you could just stand by, we're going to put you in the green room, and I'll get back to you after the show.
Thank you. Thank you, Ade.
All right, ladies and gentlemen, thank you again for joining us for On The Air Sickled. Listen, this is a global podcast. Again, like I have said before, we've gone to Canada, we've gone to Africa, we're in the UK, and of course the United States. So excited about it. Listen, don't miss a single episode of On The Air Sickled. If you're watching on YouTube, make sure that you click that notification tab so that you can be reminded of every episode that it airs from this broadcast, and follow us on our social media handles. This show will be aired on YouTube, of course, as you're watching, but also on Spotify, iHeartRadio, and Amazon Audible. So we're so excited to be able to get this information out through multiple streamlines. Also, if you understand our mission, then you also know that we have a 3-layer vision. And here at On The Air Sickled, we want to make sure that we communicate that with full transparency. So the first part of our vision is for continued growth and development for On The Air Sickled. Platforms like this, like I said earlier, it does cause the need for money. We need money to be able to sustain, to be able to continue to communicate effectively, to be able to get stories like this one with Dr. Thomas out there for you. So in that way, you know how to be able to navigate not only the medical system, but your own personal lives regarding sickle cell disease. So please, 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 please support. Your funds do go on good soil, and I promise you will see the fruits of your donation. The second thing is to support sickle cell research. Dr. Thomas talked a lot about this actually in our conversation, right? Where he himself have been asked questions from different people about what's the best methods to be able to take care of our bodies dealing with sickle cell. And so you can follow him on his social media handles where he's literally giving you snippets and nuggets of information to be able to adjust your lifestyle and to be able to sustain and be able to navigate the medical system when you're in the hospital, whatever the case may be. So in that way, you have a little bit more control over your life. So we want to be able to invest in sickle cell research to the best of our ability. And the last thing that's near and dear to my heart is the Flip the Bill campaign. Imagine for a moment that you are the main provider in your home and you are now in a sickle cell crisis. You've been admitted into the hospital and you're on day 3, probably going on to day 5, maybe even a week into the hospital. But because you're the main provider, your family is no longer getting those resources that you would normally provide. What if there was an organization that wanted to air the good, the bad, the ugly in the name of awareness and advocacy, and they could literally flip that bill, providing you a safe place to be able to share your story and to give you some financial relief? What if we took over that emergency room visit, that doctor's appointment? What if we fed your family for a couple of days, right? So we want to be able to flip the bill and to be able to give back to our sickle cell community. Listen, you can have a chance to share your story live on the air by simply going to www.ontheairsickled.com. Click the share my story link, and you could be the next guest live on the show. I'm going to ask if our production team can put up on the screen how our audience members can give. So in that way, you all can see. Those are the ways to give right there. So, of course, you can scan that QR code and it'll take you directly to our PayPal. Any monetary gift of any kind supports our efforts. You can also Zelle us at ontheairsickled@gmail.com. All right, friends, that is all that we have for today. Again, please remember to stay warm. If you need any support from our team, you can email us at ontheairsickled@gmail.com. We will get in touch with our chaplain so that he can reach out to you. And maybe you all can have a conversation. We will have a support group starting. And then I do have a very, 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 very fun announcement. And I'm excited to be able to announce this. Listen, On The Air Sickled is continuing to grow. Over the year of 2025, we've had the opportunity to launch a campaign called When They See Us. That was an effort to be able to show the good and the bad of dealing with sickle cell. And we had a lot of responses from that. So really excited about that campaign. But in 2026, On The Air Sickled is going to be launching something new, something different. And we're putting the spotlight on the children, ladies and gentlemen. Yes, it'll be called On The Air Sickled Kids. It is an opportunity where the kids will take the mic and be able to share their story. Of course, it does require parental consent. Anyone under the age 17 and under is eligible to be able to participate in On The Air Sickled Kids. And parents, you are encouraged to participate in the conversation, but not required. Listen, advocacy starts at a young age. I remember when I was a child and my mom told me, hey, I can't be here all the time. I have to go to work. So I need you to advocate for yourself. Well, here's where it begins, ladies and gentlemen. On The Air Sickled, Kids coming live 2026. Excited for it. Listen, please, again, continue to follow us on all of our platforms. This has been a phenomenal episode and conversation with Dr. Thomas. I'm so excited for more to come in 2026. Merry Christmas to you all. Happy holidays and Happy New Year. Until next time, stay warm, stay strong, and remember, you are never alone.